to conclude, the idea is to offer some advice as to how to communicate in connection with vaccines with responsibility. And I would like to thank the Association of Vaccines and Immunization from Argentina, because many of the pieces of advice we received were the result of the communication and what we see on a daily basis. In principle, I should mention that the information on science and health should be clear, brief, and evidence-based, and we should always, as journalists, resort to qualified and specialized sources. We should also avoid technical words. Whenever we introduce a highly technical word, we are distancing ourselves from the reader, from whoever is reading our piece or listening to us on the radio. So we need to try to define and use the most concrete possible terms to reach out to a broad audience. I was also saying that we need to consult with specialized sources and also issues that go beyond their academic training and professional experience, what we may call as being intrusive and intrusiveness. Whenever there was an attempt to discuss, for example, coronavirus, the experts were not consulted, be it vaccinators, people, infectologists, and pediatricians when we were talking about children, rather other specialties that were not related to vaccination and who were not the right experts to talk about vaccines. We saw this with some associations such as epidemiologists or Doctors for Truth that were misinformed and talked about COVID causing a lot of harm. And many of those individuals were not specialized and they were not even certified to be able to talk about this. And some of the questions we may ask is, who does this person work for? Does he or she have a license? Does he or she belong to any professional association? Was he or she a member of a scientific association? Did he or she publish any document, scientific document? Was he or she recommended by another source that is trustworthy? And once again, do not just believe what one voice, one expert says, but believe in experts, plural. And as Bolivia just mentioned, that voice it doesn't matter if that voice will ever receive the Nobel Prize. And also, we need to remember the vaccination is not an individual process, rather a collective process. We should not be basing this on just anecdotal evidence or personal cases. We also need to be trustworthy, meaning that we need to prove the origin of the information and clearly identify the sources that are used, be it health authorities, academic institutions, or the pharmaceutical sector. And we also need to bear in mind content that provides information on adverse events and clearly differentiate between causality and correlation, and vaccination may not be the cause of some of those effects or events. We should also foster discussions or exchanges between two voices. We should also avoid false equivalency between quality scientific evidence and unsupported or unfounded opinions. And also, given a scientific paper, we should ask ourselves, where was it published? Who are the peers? Who is financing the investigation? Was it peer reviewed? And what are the limitations to the conclusions? These would be the most important questions every time that we are faced with a new scientific paper as journalists. We should also be cautious with the so-called magazines that do not have the endorsement that they usually should have. Sometimes they do charge scientists for them to publish their own papers. They are not of any significance. Oftentimes they are fraudulent. The name is similar to that of recognized and well-known magazines or journals, but it is not that one. The most common one is Bell List. You can go onto the web and make sure, check there whether a journal is a trustworthy journal or not, or it is one of these publications that has no value. And also you need to bear in mind that some preprints are not clear as to whether the conclusions or the findings were trustworthy. And also you need to include the opinion of an independent scientist who may say whether the study is contributing something new to the field or not. It is also important to provide context. It is important to think that numbers in themselves need to be given in context. So statistical data is necessary so as not to lead to false information. And something that we saw a great deal is the paradox, the Simpsons paradox. You could see how there was some information that indicated that there were more vaccinated individuals that were hospitalized than unvaccinated ones hospitalized. And this is similar to this analogy. If we think of a road accident, if we think that 50 individuals died who did not carry a seatbelt and 950 had a seatbelt, what is the clear relationship? It is not clear, the difference, but this is a result of the fact that when we analyze information together, the result is different than when we analyze just the subset. If we look at the subset, we see that 50 out of the 1,000 did not have a seatbelt, 35 died, close to 70%, and those who had a seatbelt were 950 individuals. That is to say, most, and only 11%, 110 died. It is also important to bear in mind that the image conveys a message. The pictures, for example, do have an emotional impact. We need to avoid images showing children crying or large needles with a colorful liquid, because that may predispose to rejection. And I am always asked how to continue to talk about vaccines when individuals are not interested in vaccines. How can we maintain the attractive nature of the subject matter? I think that we need to look at the world around us. We need to have interesting approaches for these vaccination campaigns with precision. And here I would like to show some stories that I thought were nice and that I put together during the pandemic.